Hi there, I'm Dr. Nick Shaw. This is Dr. Meg Laneson. On a previous episode, we talked about kidney disease and why pets drink too much. And today we're going to revisit that. So another reason why we see increased drinking in animals is because of diabetes. That's a disease that we see commonly in dogs and cats, especially in cats. What happens in diabetes is that the body develops an inability to either produce or respond to insulin. And when that happens, the blood sugar cannot actually enter the cells of the body and be properly metabolized. So the animal gets very high levels of sugar in their blood, which then spills over through the kidneys into the urine. And then you get what's called a diuresis. Because of the high concentration of sugar in the urine, there's a lot of extra water that's secreted into the urine to keep that urine concentration more normal. You see these guys producing lots of urine, and then they have to compensate for that by drinking more too. One of the unique things about cat diabetes is that when we treat them, they can actually be cured sometimes. So maybe Dr. Laneson would like to talk a little bit about insulin therapy in cats and what we do with them.
What we are trying to do is many times replace the insulin that's not being made, and we do that by injections, and we can sometimes, as in people, we can sometimes do it with diet, but most of the time we're going to be giving them insulin. We're going to give them very small amounts of insulin, and they're going to get insulin when they get their food.
With dogs and with people, when they have diabetes, the pancreas is all scarred up and fibrotic, and return of function to the pancreas or restoration of normal insulin production isn't usually possible. But in the cat, it's different because the pancreas behaves differently, and that reduced ability to produce insulin is often due to an inflammatory or an immune response that prevents normal insulin production. Oftentimes we can reestablish the insulin production just through stabilizing the cat and trying to get them onto a proper regimen and so on. So sometimes they can be treated with insulin, particularly newer types of insulin, and they will actually get better and be able to be weaned off it at a later date.